This is a COVID-19 ward. If the patient loses their consciousness, check their pulse. Place 2 fingers on the pulse point found on the patient's wrist below their thumb. Can I get some help? Can I get some help here, please? Can I get some help here, please? Wash hands thoroughly with soap and water before donning PPE. First, don the standard latex gloves before pulling on an apron. Then place a fluid repellent surgical mask over your face. Do not feel or listen for breathing by placing your ear or cheek close to the patient's mouth. The doctor checks for the patient's responsiveness with a firm shake and a loud call. Are you alright? Are you alright? Can you hear me? Can you hear me? Check the patient's notes and determine if the patient has a valid DNAR order. The file indicates the patient's hospital number, name and signature, relative signature, doctor's signature, and date. Always check the patient's notes during assessment. Patient's notes can be found in the tray at the end of the bed. What do we do next, doctor? This patient is for resuscitation. In the case of a cardiac arrest, the patient may be taken in frequent or noisy gasps. Start compressions. The doctor and nurse are now prepared to begin CPR. If the patient is not responding to the chest compression, the doctor must call for the crash trolley. Bring the crash trolley. Place the heel of one hand in the center of the patient's chest. Place the heel of the other hand on top of the first and interlock their fingers. Adjust their hands to the correct position over the patient's chest, then begin chest compressions. The compressions rhythm is 1 to 2 compressions every second. The depth of compressions on an adult is 2 to 2.4 inches with both hands. For a child, you'll use one hand, and a baby, you'll use 2 fingers. And you'll compress to only 1/3 of the depth of the chest. A classic example is Bee Gees' Staying Alive, which is often played in CPR classes to help people find the speed. Staying Alive's tempo is 103 beats per minute, which is within the range that we need to hit. Place the heel of one hand in the center of the victim's chest, which is the lower half of the victim's breastbone, the sternum. Place the heel of your other hand on top of the first hand. Interlock the fingers of your hands and keep your arms straight. Ensure the pressure is not applied over the patient's rib and do not apply any pressure over the upper abdomen or bottom end of the bony sternum, or breastbone. Position your shoulders vertically above the victim's chest and press down on the sternum to a depth of 5 to 6 centimeters. After each compression, release all pressure on the chest without losing contact between your hands and the sternum. Repeat at a rate of 100 to 120 minutes to 1. Remove the patient's top and prepare a clear area for the shock. The crash pads are removed from their seal and placed on the patient's chest, following the instructions on each pad. The correct placement of the crash pads is with one by the right shoulder and the other by the left side of the ribs. Repeat CPR at a rate of 100 to 120 per minute. Attach the defibrillator. Start the defibrillator to begin reading the patient's heart rhythm. Minimum interruptions.
No shock advised.
The defibrillator has declared the patient non-shockable. This verdict means that you cannot shock because the heart is not in a shockable rhythm.
Shock advised.
The defibrillator has declared the patient shockable. This verdict means that you can shock the patient.
Stand clear. Push to shock.
When the machine informs that the patient is shockable, stand by and avoid touching the patient. Check for hazards and a gap between the patient and the staff. Doctor and nurse stand clear. Oxygen away, stand back, everybody clear.
Start CPR.
Immediately resume CPR for 2 minutes. Minimum interruption. If the patient continues to be unresponsive, the doctor must resume chest compressions for 2 minutes.
Check for pulse.
Continue compressions at a rate of 100 to 120 per minute.
Stand clear. Push to shock.
The doctor detaches the patient's oxygen tube and steps back from the patient along with the nurse. Stand clear, shocking now.
Stand clear.
Right, please arrange for the chest x-rays, blood tests and the 12-lead ECG. It is essential that you record the resuscitation details clearly in the patient's medical records.